Hi, Dr. Brighten here, and we're going to talk a little more SIBO today. Specifically, we're going to talk about prevention. So I was just at the conference, a SIBO symposium at the National College of Natural Medicine in Portland, Oregon, and we were discussing what different motility agents that we can utilize. In my practice, I like to use natural therapies such as Modopro, Iberogast, or ginger, and there was discussion around the antibiotics that can also be used. Now, it's important following your treatment of SIBO that you continue to have these motility agents in place. I generally like my patients to be on them for at least 3 months, but it can really be several months depending on your case, and how difficult the treatment has been and how you've responded is also really important. But what was discussed was using Iberogast, and some physicians were saying that they get better results with using 60 drops at night. Others were saying 20 drops 3 times a day or 20 drops once a day. How I tend to approach patients is I like to start with 20 drops at night and see how they respond. If it doesn't seem to be gaining us enough traction, then I like to increase the dose depending on the individual. Ginger is something that I use quite a bit in my practice. I work with a lot of mothers who have SIBO and they've recently had a baby, or maybe they're pregnant. During pregnancy, we don't like to use the antimicrobials, and we have to be cautious what we use in a lactating mother. However, we can use the motility agent, such as ginger, to help the gut move and to keep your bowels regular. So with ginger, I typically like to start on a dose about 500 milligrams. I'll often have moms, if they're nauseous as well, during pregnancy and also postpartum, drink ginger tea in addition to that because it's nice to sip throughout the day. Dr. Melanie Keller actually presented her findings on using ginger, and she was stating that she had good results with anywhere from 1,000 to 2,000 milligrams. Now, ginger can be really warming and not always tolerated. I was one of the lucky moms that when I was pregnant, ginger actually made me really nauseous. So if you're one of those people, don't use ginger. Definitely talk to your doctor about alternatives. But starting with 500 milligrams and maybe using 500 milligrams up to twice a day of ginger can be a good prevention for SIBO, but it also can be something that if you're in a position like being pregnant or early lactation and you're not able to treat the bacteria specifically, you can still stimulate the motility and get symptom relief that way. All right, I hope this has been helpful, and I'll be chatting again with you soon.